Good afternoon. It's so wonderful to see people logging in. We'll give attendees a few more minutes, couple more minutes to log in, and then we'll get started. Thank you. I think we can get started. If there's any questions or concerns, please put them in the chat. And my colleagues will help answer your questions. We want to ensure the webinar is as accessible as possible for everyone attending. My name is Kimberly Beer. I'm the Senior Director of Public Policy and Advocacy at the Christopher and Dana Reeve Foundation. I am a middle-aged white woman with a brown bun and glasses. I'm seated in my office with a blurred black background, and I'm wearing a black and white dress with a lime green necklace. We're so thrilled that everyone has joined us. Happy spring, happy April. I think the last time we all spoke together was in the winter in January. So we're thrilled to bring everyone back again to give an update on what's been happening in Washington, D.C. and all the activities that the Reeve Foundation has been up to. I want to thank specifically the regional champions who will join the call today, as well as anyone new or those invested in other programs at the Reeve Foundation. I want to thank you for your support and your attention and taking time out of your day to join us. Next slide, please. Today, we will, of course, do introductions and a welcome. We'll give some much needed congressional updates. I'm sure you've all been following the news. We've had wonderful successes in the early part of this year, which we will update you on. We'll talk a little bit about FAA reauthorization, which includes key updates around our air travel advocacy. We'll talk about appropriations and funding for the Resource Center. My colleagues will give in-depth updates on our coalition activities, as well as our grassroots, which is really, really the crux of the work that we do here, which is you and your involvement and your investment of time, energy, and passion. So, and then we'll of course have time for questions. And please, I'll be monitoring the chat box, and we'll have time throughout to answer questions, and as well as at the end too. Before we get started, I'd like to introduce my fellow panelists, John Sawyer, Angel Hines, Gerard Arnhem, and Celicia Lomax. We've been working together for several years, and we are a wonderfully supportive and dedicated team, and we're so glad to be here to give you much needed updates. So I think I'm passing it over to John Sawyer.
Great, thank you so much, Kim, and thanks to everyone for being here. My name is John Sawyer. I work along with my colleague Celicia at Waxman Strategies, and we're a consultant to the Reeve Foundation and honored to be doing this work. I'm a white man in my mid-40s with brownish blonde hair, a little bit of gray, as sitting in front of a blurred background and wearing a blue sweater. So I'm going to start by giving some updates on what's going on in Congress and how it's relevant to the Reeve Foundation's and the community's policy agenda. So we can go right into the next slide. So as all of the folks on this webinar, I think, know, one of the main focuses of the Reeve Foundation and policy and grassroots advocacy work is to advocate for additional funding for and continued funding for priorities that we follow and that we track in the annual appropriations process. And that process is the annual process by which government, the Congress sets funding for all the programs in government on an annual basis. And it typically is over by about, it typically tracks the timeline of the federal fiscal year. So in order to set the next fiscal year's budget, Congress is supposed to finish up their work before the fiscal year starts, and that fiscal year starts October 1st. As is often the case, this year, Congress did not finish their work on time, and in fact, did not finish the annual funding process and the annual appropriations process until almost halfway into the fiscal year. And so they finished up that process after a lot of wrangling back and forth between House and Senate, Democrats and Republicans. They finished it up earlier this year, last month in March. And the good news, and I won't bury the lead here, the good news is that thanks to the efforts by advocates around the country, that final funding bill for fiscal year 24 did include full funding for the Paralysis Resource Center, which is operated by the Reeve Foundation, and for several other really key funding priorities. And so that means that the programs are fully funded through the end of September, which is when next year's fiscal year 2025, begins. And I just want to say, we'll talk more about this victory and the importance of the grassroots connections that you have to all of your members of Congress, the actions that you took, the emails and texts and tweets that you sent. But there was a point in this process where the House version of the bill had proposed a major cut to the PRC, almost a 50% cut. And so being able to end the process with full funding, with a complete rejection of that cut, was a very, very big success. Next slide. So as I said, this was a big win. This was not a foregone conclusion that Congress would spend the full amount of money on the Paralysis Resource Center of $10.7 million. And just to say, I think both our team and the Reeve team, as well as partners who we've worked with for many, many years in the disability community, as well, of course, as advocates, took a number of different steps to really oppose that cut and push for full funding for the PRC. And so those steps included the action alerts that many of you got, and the action that you took through those action alerts means a lot. Having sat on the other side and worked in Congress, I can tell you that congressional offices track the amount of those action alerts that they get. They set priorities based on what they're hearing from their constituents about. And so taking those actions is one important step to making our voices heard. And we'll talk in a little bit about what, Gerard will talk about what the current action alerts are and where we need your help going into the next fiscal year. We also put together, and the Reeve Foundation issued, a press statement about the proposed cut and the need to fully fund the PRC. That was really well crafted in partnership with the Reeve communications team, but really, laid out the stakes of what it would mean to cut a program like the PRC, which in the context of the entire federal budget is not a whole lot of money, but what it would mean to cut that program by almost $5 million and the impact that that would have had on the community. We also sent a letter from the Reeve leadership, Maggie and the board, to all congressional offices, laying out those same stakes, calling for a restoration of the funding. And we worked in close coordination, as I mentioned, with coalition partners, other groups that focus on disability programs, disability advocacy, in particular, like the Limb Loss Resource Center team, and many others who are also facing cuts in this proposed legislation, we coordinated closely to make sure that our advocacy efforts were aligned and not overlapping in the way that, they were forced to choose between one program or another. And then, Kim and I spent a number of days up on the Hill in person meeting with some of the key congressional offices who really make these decisions in the end, and educating them about the impact of the Paralysis Resource Center, about the impact of the Limb Loss Resource Center, about the impact of some of the other programs that were facing cuts, and really making the case that these kinds of cuts were really misguided and not the kind of deficit reduction that was actually needed, and really would have led to not just bad outcomes for the community, but really to probably increased costs for the federal government over time. And again, thanks to all of you, thanks to that advocacy, thanks to that coordinated effort, we were able to accomplish that goal together. So we are turning now to next year's fiscal year 25 funding process. Gerard will talk about that in a little bit, but just to say a couple of things about that as we go forward. Now that the FY24 levels are set, Congress is deep into its work of starting the process of setting next year's funding levels for fiscal year 25. That process kicked off in earnest last month when the president's budget request was issued. And the president's budget request is just that. It's a request. It's what the administration would like to see from Congress. And that request called for Congress to provide, once again, full funding for the PRC. So that starts us in a good place. Now both the House and the Senate are holding hearings and will begin to do the work of actually writing the funding bills. And so one thing, and Gerard will talk more about this, but to show support for the Paralysis Resource Center in that process, which remember, Congress has to determine funding levels for hundreds and hundreds of government programs out of a limited pot of money. And so they need to hear from their colleagues which programs are a priority. We are lucky once again to have leadership from Representatives Brian Fitzpatrick and Representative Nikema Williams, who are circulating a bipartisan letter to their colleagues, which members of Congress can sign on to and add their name to, that will then go to the Appropriations Committee and say, please fully fund the PRC. So we'll talk more about this, but that letter is currently circulating. They're currently adding signatures. And so one takeaway from today's meeting will be everyone should be have a plan for how are you going to connect with your congressional office and ask them to sign that Fitzpatrick-Williams letter. The more members we get signed on to that letter, the stronger the show of support for the program and the better positioned we are going into this sort of topsy-turvy appropriations process, which will probably last throughout the rest of the year. So more on that when we get to grassroots, but again, want to thank everybody for all of their efforts to continue funding for the PRC, to advocate for that funding. And with that, I'm going to turn it over to my colleague Celicia, who's going to talk a little bit about transportation.
Thank you so much for that, John. And I just want to echo also John's earlier comments, thanking you all for your engagement and dedication to ensuring that the funding for the Paralysis Resource Center could be fully there after all of these negotiations. It was incredibly helpful and definitely fruitful in the end. And I'm sure Gerard will share more for fiscal year 2025. But hi, everyone. My name is Celicia Lomax. I am a Black woman with Black curly hair and a ponytail. I'm sitting in front of a blurred background in a black and white blouse and large white earrings. It's a pleasure to be here. So I'm going to shift gears a little bit and focus on transportation in particular, on the FAA reauthorization. And so the Federal Aviation Administration for Congress also has a must-pass bill that they go through every 5 years. In a similar way to the government spending and appropriations bills that John was just talking about. The FAA reauthorization was also set to expire in September of last year and has gone through several stages of negotiations and extensions on their funding to the point now where the funding is now set to expire on May 10th in just a couple of weeks of this year. So far, the House actually last summer has been able to pass their bipartisan FAA reauthorization bill. And right now, what we're focused on is in the Senate side. Particularly right now, there is a committee that has that sort of authority to dig deeper into the provisions of the FAA reauthorization. And that is specifically the Senate Committee on Commerce, Science, and Transportation. They've had hearings earlier in the year, and at this point, they have actually moved forward with a 5-year FAA reauthorization bill, which now is looking to be considered by the full Senate. Part of the reason why this has taken them such a long time to go back and forth on negotiations is because there were some disagreements, specifically on pilot training requirements. It was a combination of questions around how many hours should be required for pilots to do their training, and also the forum in which they do that training, whether it's virtual or in person or a combination of the two. And so those negotiations have been ongoing. We are really hopeful that we'll see a full FAA reauthorization bill by that deadline in May. There is a possibility that they could extend that again. That is not abnormal. We have seen with the FAA reauthorization that it has been pushed several times in previous versions of the bill. But what's also important with this one is that there are current proposals within the FAA reauthorization bill that includes several disability-related provisions. Some of that is connected to training specifically for staff and any penalties for failure to meet some of those new standards, whether it's related to wheelchair damage or how staff work with specific passengers as they're transporting them through their journey. So this actually now leads to the next slide, which is based on the Department of Transportation. They have recently announced a new proposed rule that's really meant to strengthen safe and accessible air care or air travel through the Air Carriers Access Act. And so with this proposed rule, there are a number of requirements that are basically set here that would better accommodate passengers with disabilities. Some of that includes new standards just to ensure that there is prompt and safe assistance for passengers and for their property. It also includes enhanced training specifically for staff who might be physically assisting passengers with disabilities and or physically handling their wheelchairs. We know that we've heard from several of the folks on this webinar, as well as many others, that this has been a challenge where folks have not had prompt and safe assistance from staff, unfortunately, or have had a number of really difficult times also in relation to their wheelchair. And so there's also new actions that would be included in this new proposed rule that's meant to additionally protect the wheelchairs if they are damaged during transport. There's some additional pieces there that's meant to strengthen that. And so I just want to point out, I know that there were several folks who filed formal complaints to the Department of Transportation, who've had conversations with a number of folks within the Reeve Foundation and have helped the Department of Transportation push towards actually making this rule in that way by really advocating for some of those challenges and the ways in which they could potentially address it. So want to thank you all for being engaged there and making these issues apparent to the Department of Transportation. Just want to note that that proposed rule is now open for public comments, and those are due by May 13th. So I think that's about 3 weeks for folks to submit comments. If you scan this QR code that is on the screen right now, you'll go directly to the site in which you can submit your comments. You're welcome to also ask any questions to folks within the Reeve Foundation staff that might be able to help you as you put those together. But again, another really exciting rule that we're seeing come out. So I will now pass over to Angel to share a couple of additional updates.
Thank you so much, Alicia. Hi, everyone. I'm Angel Hines. I am a 40-something, I like to call Gen X African-American woman, brown skin, dark hair, gold earrings, and a gray and white striped shirt. And I'm happy to see everyone that's joined. So I'm just going to give you a few of our coalition updates, some of the things that we've been working on. It's been a very busy few months, but first I'll start with the ITEM Coalition. We have been doing a lot of work on coverage, Medicare coverage issues. We have been in partnership with other coalition groups and been meeting with legislators to discuss coverage for intermittent catheters. We know that there are so many out there and how important that is to this community. And we want to make sure that we take care of getting coverage, and we want to make sure that we're meeting with legislators so we can hopefully get a letter to CMS to talk about the billing issues with intermittent catheters. And we're also still pushing CMS to open up a comment period for standing power wheelchair coverage. I really don't have much to update you on there, but hopefully soon. We recently sent a letter to CMS with other coalitions with some more information from clinicians and research on why coverage for standing power wheelchairs is relevant and necessary for us. Next up, I sit on the CCD Housing Task Force, and just wanted to share that April is Fair Housing Month. Last April, it was the 55th anniversary of the Fair Housing Act. And so the Biden administration last April announced a proposed rule that would strengthen the fair housing rule. And that was last year. So we signed on with many other disability rights advocacy organizations, encouraging and urging the Biden administration to finalize the updates to this rule that will definitely help to provide more accessible and affordable housing for people with disabilities. And next we have our disability rights. There was recently, just a few days ago, the DOJ released an update to guidelines for the ADA and protecting the rights of voters with disabilities. We are going to do more in this important election year, just educating the community on access and issues and things so everybody can go out and exercise their right to vote. But I wanted to share this now since this rule just came out. The guidance now states that the ADA also prohibits a state from categorically disqualifying individuals who have intellectual or mental health disabilities from registering to vote or from voting because of their disability or guardian status. So that's a big change. And then it also updates language that says voters with disabilities may receive assistance in all aspects of the voting process. This includes requesting, completing, and returning a ballot, whether in person, absentee, or by mail-in ballot. So, like I said, we will be sending out more on this, but this is really timely and relevant. We want to make sure that you're informed on this issue. Next slide. April is also Care Workers Recognition Month. So the White House recently declared this by proclamation. And April 18th was the one-year anniversary of the executive order dedicated to strengthening the care economy. The White House held a convening on care and care workers last week. They're having something else. I think today, and there's just they have been doing a lot to bring attention to how important this is. Caregiving, as you guys, most of you know, and that this is a top policy priority for the Reeve Foundation. So we just continue to work to bring light to this and to prioritize that adequate policy solutions need to be made for caregivers. Next slide. And just a few, so you're aware that we have endorsed a few legislation bills that are dedicated to helping caregivers. So there's Connecting Caregivers to Medicare Act, which would make it easier for family caregivers to get information that they need to help their loved ones when it comes to their Medicare coverage. And then there's Alleviating Barriers for Caregiving Act, which just helps to streamline the process with all the different agencies. And then the Lowering Costs for Caregivers Act. So there's a lot out there. And if anyone wants any information, more information specific on any of these specific bills, feel free to reach out to me and I can share with you more. And that is all I have from coalitions. Next is my colleague Gerard.
Well, thank you so much, Angel, for those wonderful updates. Hi, everyone. My name is Gerard. I'm the Grassroots Advocacy Manager with the Reeve Foundation. And I am currently sitting in my office in Washington, D.C. I'm a white male with a beard and brown hair, wearing a navy blue collared shirt. But I'm just going to give everyone a quick updates on our grassroots front. And let's go to the next slide. So just like John said earlier on in the webinar, with funding levels set for FY24, Congress is now turning its attention to setting up the appropriations for fiscal year 2025. And like John was saying, there is a Dear Colleague letter circulating the House led by Representatives Brian Fitzpatrick and Nakia Williams. And, this Dear Colleague letter is asking members of the House to sign on and show their support for the PRC in FY 2025. So with this in mind, the Reeve Foundation has published a new action alert, which asks all of our online advocates for change and regional champions to reach out to their House members and urge them to sign on to the Fitzpatrick-Williams Dear Colleague letter and fully fund the PRC $10.7 million for FY25. So if you look at the slides here, I have a QR code on the right of the screen for anyone to scan, and we will be sending out the link to the direct action alert in our follow-up email. But again, this is just for, if you want to take action right now, please go for it. You can scan the QR code, and after you've taken action, please share the action alert, wide within your networks. We want to ensure that your House members are educated on the impact the PRC has on the paralysis community. And if you would like to go, a step further and really kind of form a relationship with your House member's office, you can urge them again by sending, personally reaching out and sending an email to your member's office, maybe stating some of your experiences of using the PRC and what the PRC does for the paralysis community. But in my follow-up email, you can always contact me or you can contact me at the end of the webinar to get your representative staff members contact and some tips on what you can have in your email. So again, this is a great opportunity for anyone to start a working relationship with your member of Congress or enhance an existing one. And I know in the past few weeks or so, since this action alert has been up, I've been receiving a lot of emails from our regional champions asking to send a personalized email to their House member. So for any of the regional champions watching now, thank you so much for doing that. And there still is time to, send another email to your member of Congress to, urge them to sign on as well. But again, just thank you so much for taking action on the action alert and, just make your voice heard. It matters. But before we move on to the next slide, just quick checklist. So fill out the action alert that we have now up. Then if you would like to do more, reach out to me. I can get you the staff members' contact info. And you can send that email back. You can send a personalized email to your member's office. And you're participating more in our grassroots advocacy platform with Reeve. So let's go to the next slide. Oh, hold on. Okay, there we go. All right. Oh, sorry. Lagging. Here we go. All right, so these next couple of slides are just going to show some recent events since we've had since our last webinar in January. And the first of I just want to share with you all quickly is the annual Reeve Summit, which took place back at the beginning of March this past year. During the summit, healthcare professionals, advocates, caregivers, and community members came together in Washington, D.C. to delve into the realms of support for those impacted by paralysis. So these conversations and connections are crucial as we build healthier futures together. And in the last picture, we even had some regional champions who journeyed from various parts of the country to Washington, D.C. to participate in the Reeve Summit. Some of these photos were taken throughout the last day of the summit, but again, all the way to the right is regional champions Catherine, Jamie, and Justina, and then me in the background. But they're all from different parts, Florida, I think Pennsylvania, and Louisiana. So it was just really great to connect with regional champions, meet them in person, and also just meeting other advocates who are interested in joining the Regional Champions program. The next event, again, you already saw this slide because of the lagging, but about 2 weeks ago, my colleague Kim and I, we were happy to attend a disability history event hosted by the FDR Memorial Legacy Committee in Washington, D.C. But at this event, it was a 4-part educational documentary series with audio descriptions were shown and explained how Americans with disabilities changed a presidential memorial to show the world what real leadership looks like under the FDR administration back in the 30s. But this series outlines the fight for the wheelchair statue at the FDR Memorial in DC, and that's the middle picture. And is dedicated to the disabled advocates and allies who fought for disability rights and representation. But it was specifically created to educate both middle school and high school students. And there even was a middle school class at the event on a field trip to watch the film. And then they were going to go on to go see the monument in person, the FDR Memorial in person. But after the screening of the film, there was a Q&A session with Nyla Morton. She's a disability rights advocate and the film's narrator, but also a Reeve Foundation blogger. And she was joined by Jim Dixon, who is a disability rights leader and director of the FDR Wheelchair Statue Grassroots campaign. And in the last picture, both are seen in the last picture. It's Nyla, Kim, Mary, who's the executive director of the FDR Memorial Legacy Committee, and then me and Jim on the end. So that was a really great event, and I will be sharing that documentary clip. It's on YouTube, and I will be sharing that link in the follow-up email. So if anyone has some time, please check it out. One sec. All right, so last week, I was actually in Detroit, Michigan, hosting yet another regional advocacy training. This time it was at the Rehabilitation Institute of Michigan, also known as RIM as the acronym, in downtown Detroit. And this was one of the largest regional advocacy trainings we've had to date, with about 25 individuals who attended, and most of them were wheelchair users. But again, if you've seen webinars in the past, just to refresh everyone, these regional advocacy trainings inform participants on how to engage in the legislative process and become effective advocates for Reeve, while also learning more about the Reeve Foundation and the resources and programs provided by the PRC. Usually with these events, I will send resources to the location so that attendees who decide to sign up and attend the in-person event could take them with them on their way out or before just to review them. And then any of the leftover resources I left with RIM so that they can be displayed in their inpatient and outpatient levels for individuals to take them if they need. You'll see in some of the pictures, I have one of my colleagues, Anna Holly, who is a Reeve Foundation information specialist, and she joined me in this event and helped making this event such a success. So thank you to Anna. And not pictured, but also the folks at RIM, Carrie and Mirio, they were really, really successful in helping me plan this event, but also getting the word out and having people come. So, and then I also, at the end of all these regional advocacy trainings, it's kind of a tradition now, I'll take a selfie with everyone who attended. So these are really great, and it was really great to have this regional advocacy training done at a rehab facility such as the Rehabilitation Institute of Michigan. And I would love to do more at some more rehab facilities, just because again, we're able to get resources to individuals that are currently going through rehab, and that it makes it more available and have easier access for them to reach out to the Reeve Foundation, to an information specialist like Anna. But oh, sorry guys. Hold on. One sec. Oh, here we go. Oh. All right, so next up, I just want to kind of briefly mention, to save the date, coming in September 2024, we're going to be having another virtual Congressional Advocacy Day. And this is a great opportunity for anyone who's a regional champion and our advocates, or anyone on this call, to meet with your legislator's office, build a professional relationship, and advocate on behalf of yourselves and for the Reeve Foundation. So more details will be released in the coming months, but I just want to, I'll be reminding some regional champions in my newsletter that goes out every other week or so, to be on the lookout on our social media pages for any type of registration information. But we will be releasing this information in the coming weeks. Again, like I said, this is a great opportunity to really interact with your member's office, and I do hope everyone on the call right now will sign up when that information becomes available. So I want to put that on everyone's radar. And then my last thing I just want to talk about quickly is some upcoming events with the Reeve Foundation. So tomorrow at 3 p.m. Eastern time, there'll be another webinar for the Ask Linda Healthcare Professional Series. Nurse Linda usually holds these events monthly, and it allows it for members of the paralysis community to write in and get their questions answered on anything related to SCI or paralysis. The other event that I also highlighted is going to be on Wednesday, May 15th at 1 p.m. Eastern time. Well, there'll be a support group leader training, which is designed for leaders of support groups for people living with paralysis and or their family members, caregivers. But the training will provide an introductory overview of support group leadership, as well as a deeper understanding with what to focus on for best practices. So I also have another QR code listed. You can go to our website, www.christopherreeve.org, on our events page, to see the latest upcoming events and webinars that we are hosting. And the QR code will take you right to that events page. But now that this kind of brings us to the end of our webinar, and I just want to thank everyone for joining us, and just please reach out to me if you're interested in joining the Regional Champions Program. And thank you all again for anyone who's taken action on our action alert to help preserve and fully fund the PRC, both in fiscal year 2024, but also now we are on the path to fiscal year 2025, and we would like to maintain that funding and be fully funded. So if we have any questions, we can answer them. I'm gonna pass it back over to Kim, and I will be looking at the Q&A. But again, just thanks everyone for joining us, and we're here to answer your questions.
Thank you so much, Gerard, and all of my panelists. It was a fantastic update. I wanted to address a question that came into the chat box from Helen. How do I get disability resources active in Fredericksburg, Texas? There are not many resources available for wheelchair users in this community. Helen, please reach out to us. We can connect. We can work with you offline to see how we can get resources into your community. So we're happy to work with you one-on-one. And then Howard asked about the coverage for intermittent catheters. What programs cover them now? What programs are we working on expanding coverage? Howard, this is an issue, and of course, I'll first go to my colleague Angel. Angel, the question is, can someone talk briefly about the coverage for intermittent catheters? And then what programs cover them now? And if you need help answering that, I think I can answer that.
Well, I'll answer, and then you can help clarify if I'm mistaken or not clear. So right now there is coverage. We're specifically working on Medicare coverage for the catheters, but as you know, there are many different types. And so right now, let's say there's coverage for 3 types. And what we are working on is expanding that through Medicare. And then usually when you expand coverage through Medicare, their other insurances will follow suit. So do you think, is there anything else you would add, Kim?
No, that is great, Angel. I think the only thing I would add is that the reason that they're trying to identify new codes is because there's so many different types. And I think the current codes are covering many different types of catheters, if I understand correctly. So we're trying to make sure that we have the appropriate codes for the appropriate catheters, so everyone gets access to the ones that they need. And we're happy to follow up with you too, as well, Howard. Thank you, Angel. I think those are the two questions we have. Gerard will follow up with recording and a follow-up email, including the slides. If there are any questions, please feel free to reach out to any one of us, and we'll be happy to get back to you. We're so grateful for all of your support and your time today, and we can't do this work without you. So please reach out if there's anything more we can do together. Have a great rest of the afternoon. Oh, and yes, please take the survey. We really take input from the community very seriously, and we want to make sure we can improve these educational webinars. Thank you so much.